Hi, welcome to one of our first educational videos from Illinois Regional Pain Institute. My name is Ann Alton. I'm a physical therapist here. You might also see Lindsay Callahan while you're here. What I'd like to go through, and this is for our patients, but anyone who is struggling with chronic pain is welcome to watch these as well. The first video we'd like to do is on pacing. Okay, and this is how do we progress our activity levels and our exercise in a safe way when we have chronic pain. So most of the time, people who don't have chronic pain, they're used to kind of this no pain, no gain kind of idea. That's really great if you don't have chronic pain. If you have chronic pain, our nervous systems have been sensitized to a point where even though we're not doing any damage, we can still make ourselves pretty miserable for a number of days if we overdo it. This is a way that we can progressively increase our levels of activity and our strength and still not experience those days of increased pain. So I'm going to go through just basics of doing this. I'm a little bit nervous, so I'm going off of a script. I hope you all don't mind. Basically, we're going to use the touch it, tease it, nudge it idea of working with pain. So, and working with exercise. So, basically, for strengthening, now I'm going to just go back and talk a little bit about, I have a lot of patients who call all of these exercises stretches. Stretches is any time that you lengthen a muscle, okay? And it should be a very gentle, very feel good pull, okay? The other exercise is strengthening, and that is any time that you are lifting against gravity or lifting against some sort of resistance in order to use that muscle and shorten it, typically shorten it, in order to improve the amount that you can lift or push or pull with that in particular muscle. So in strengthening, we are using touch it, tease it, nudge it, and we're going to monitor for two things. We're going to monitor our pain level, and we're going to monitor for our fatigue level. When you monitor for your pain level, you first check to see how am I feeling right now. Like say, okay, so I may be at a 6 right now. That's going to be your baseline for these exercises. You're going to check in during your exercises and then again afterwards. If your pain level should increase during this particular exercise, you should stop. Okay, and this is different from people who don't have chronic pain. Okay, this is part of our retraining of the nervous system to accept activity levels as being safe. This pain question should be a simple yes or no. The answer I'm looking for personally is no, that didn't hurt. Why should that hurt? Okay, that's the answer you want. If it's well, it's a little, okay, that's pain, we're going to stop. Okay? This is our body's way of protecting us from injury. Okay? We call this our protect by pain line. We do not want to cross this during exercise. And partly the reason for that is because our protect by pain line, when we have chronic pain, is at a point where it's so low that setting it off is only going to perpetuate that pain line. Sometimes your form may be off and it may be compromised. Maybe your posture is abnormal, so continuing to push through could actually cause you some injury, which is not our goal. The other thing is that sometimes the exercise just doesn't feel right for your body. It may be not the right exercise for your body at this time, and we need to listen to that. We likely have another idea for something that you can do instead to strengthen either the same muscle or to get at that part of the nervous system which may be what is complaining. Let us know, and we'll discuss that at your next appointment, and that's not a problem. People often don't want to take problems to us because they may feel like they're not getting anywhere, and they want to make us feel better, and they want to make us, they like us, and they want us to feel like, oh, we're helping them. But we can't help unless we know that there's an issue with the exercise. So if you're having trouble doing an exercise at home, whether it be wanting to do it or just that it hurts, let us know. We'll discuss it at your next appointment. We'll figure out something that does work. If your pain increases after the exercise, note for how long that pain increase and by how much. Okay, so that could be, the day after, I paid for it. Okay, that's good information to have. Bring this to our attention at your next visit. We may want to reduce the number of repetitions that you're doing. We might want to change the exercise that you're doing and see if your symptoms change afterwards. You should also be monitoring fatigue level. Okay, so we're going to check how you feel before to serve as the comparison, then during and after the exercise. There are 3 basic levels of fatigue that we're going to talk about. There's low. Oh, that was easy. Like, I don't know why I'm doing this. Medium. I can feel that. I'm starting to get tired. I can feel that muscle working. And high is I'm really struggling. I'm not sure I can finish this set. That sort of. We don't want you there. We want you more low or medium. Okay, if you experience medium or high during the exercise, this is a sign that you're getting ready to stop. Again, medium is kind of where we want you. Okay. Often as we become more tired, the exercise can become compromised. So if we're starting to, the muscle that we're working is starting to get tired, sometimes other muscles will take over. So for example, if we're doing this exercise, we're lifting here, okay, the muscles that we're working start to get tired. Now we're going to start doing this. Okay, and since maybe we have neck pain, this is going to make it feel worse. So as soon as you start to feel tired, go ahead and stop. If you push through these levels of fatigue, the other thing that might happen is that your muscles may respond as though they had a strain or an overuse injury, meaning that you are more likely to be sore for several days rather than just for 1 or 2 days. If you feel exhausted the rest of the day after doing the exercise, this might also be an indication that you're doing too much. Right? The best way to keep track of all of this is to write it down. Write down on your exercise log, bring it in to your next therapy appointment, and that way we can see how you're progressing. There may be also a thing where we want you to do this every other day, and it may be that we might move it to every 2 days. Because your body just needs extra time to recover, and that happens sometimes too. So strengthening exercises should be performed 1 time every other day. We want you to repeat each exercise. We want you to work up to 15 repetitions because we're working on the endurance of the neuromuscular system. A lot of times people come in and their strength is fine. It's just the pain. I walk for 2 minutes, or I walk into the grocery store and I'm already in pain. That's a sign that there's an endurance issue and not necessarily a strength issue. So what we're working on is endurance. So we're going to go for 15 repetitions. As long as there's no pain or anything greater than low fatigue, you can repeat a second set of 15. A lot of people will say, well, I can do 15. I start to get into that second set, and at about 5, I'm starting to feel really tired. Great. Stop there. Mark it down. Progress towards being able to do 3 sets of 15 repetitions using these guidelines. And once you're able to perform those 3 sets, we're going to add some resistance, and we're going to start that whole progression over again. So after you can do 45 of this one exercise, then we're going to add a little bit of weight, but we're going to start back at doing 1 set of 15 or even 1 set of 5 if that's what it takes. We're going to keep following this plan until we're up to the goal of the resistance for each exercise. Once you reach the goal, then we're going to be doing these exercises 1 or 2 times a week just to keep that maintenance. For stretching exercises, now remember these are basically the nice gentle stretching exercises, lengthening muscles. They should be performed at least 5 times a week, with the ideal frequency being every other day. They should never ever be painful. I always tell people, if you have a scale of 0 to 10, 0 being I'm not stretching this muscle at all, 10 being wow, I just ripped the muscle straight out of the bone, I want you like a 2. Okay, I really don't want very much stretch at all, just until you start to feel the stretch. The reason for this is that your pain is your body's way of warning you that an injury is about to occur. When we stretch too hard or incorrectly, we can actually be straining the muscle, which makes us then even tighter, and we get kind of a rebound effect. And we're more likely to be sore the next time we try to stretch you. Mild discomfort is acceptable. Easy for me to say, as long as you stop and hold as soon as the stretch or pulling sensation is felt. We ask that most people hold their stretch for about 20 to 30 seconds unless you have been otherwise instructed. Sometimes we'll start you off at just 5 to 10 seconds because holding it is just for too long gets your body to start saying, oh no, wait, this is too much. So that will help you to get used to doing the stretch correctly before progressing to longer holds. Okay? With stretches, do them as often as you want, as long as they make you feel better. I hope you've enjoyed this educational video from Illinois Regional Pain Institute. Again, my name is Ann Alton. If you'll hit the like and subscribe in the description below, we'd highly appreciate it, and see you next time.